Okay, so hopefully that was, oh, so here we go. So this was a case someone threw, and I think they tagged me, and I think you are here today. So thank you for getting involved and getting me involved as well. I always like having a look at an X-ray. So this patient, they have got a X-ray of their hand. And what can happen sometimes is that patients will get an X-ray of the hand, mainly because they've fallen over, they've got pain within their scaphoid, and they're worried about a scaphoid fracture. And so when we look at this one, hopefully you can see that in the region of the scaphoid, that the boat-shaped bone of the wrist, this thing over here, there is what looks like a very well-defined spherical lesion sitting over here. Now, this has got a very exactly well done. It's very well defined. Literally, I can get a pen, I can draw it for you. I'm not saying that, oh, it could be extending over this way. You can't see bony expansion anywhere. So there's no bony expansion anywhere at all. When you look closely, there's no cortical reaction as well. So there's no kind of reactive process going here. No soft tissue reaction. You don't see any sort of bump over here as well. So what you're looking at is you can't say benign, you can't say aggressive. You've got to go. You can't say a benign versus malignant. You can say aggressive versus non-aggressive. So this is a non-aggressive lesion based on the imaging findings that we have. And actually, I've seen these described as intraosseous ganglion cysts. And it's not just here you'll see these. You can see them on the shoulders, you can see them on the knee, the tibia mainly, actually, where you see them. Now, you're not usually that bothered, but you have to imagine that you've got cystic transformation of the intraosseous structures, and that can actually result in slight weakness. So they can end up getting pathological fractures of these. So sometimes you do get fractures going through these lesions. As well. So it may be the case that they're going to fracture anyway, given the traumatic event that they had, but sometimes it can actually act as a bit of a catalyst. You get a fracture there, fracture, and the whole thing fractures all the way across because they've got a kind of what is otherwise a non-aggressive lesion, but resulting in some architectural weakness. Right, so yeah, thank you for that one. I do appreciate having a look at this one. And again, yeah, someone tagged me on this one. I think the last three are tags, which is great. I really do appreciate these.